Welcome to the Progression Health Podcast. This is episode 1 in the health management series, and I'm here with consultant cardiologist, Dr. Sanjay Gupta. He works in New York, in the UK. And Sanjay, would you like to tell us a little bit about yourself, about the work you do, and then also a little bit about the social media work you do as well?
Thank you very much for having me. I'm really excited to be on your podcast. My name is Sanjay Gupta. I'm a doctor. I trained in the UK and then spent a little bit of time in America, in Boston, Massachusetts, where I finished my fellowship and then came back to the UK and took on a consultant cardiology post in York. And I've been there for 10 years now. As a consultant cardiologist, I sort of deal with all cardiac conditions, diagnosing them, managing them. So I'm a general adult cardiologist. I have an interest in cardiac imaging, but on the whole, I just sort of am a general cardiologist. You asked me about my social media work. This started about 7 years ago when I'd just sort of taken on my consultant post and I was sort of beginning to get a little bit bored, and I was thinking, well, now what? And I also started getting a little bit frustrated because I started realizing that I wasn't getting anyone better. I was, I would see the same patients come back. So it almost felt like I was putting layers of sticking plaster on patients. They came in with something, I put a sticking plaster, they go and they come back. And it made me question as to exactly what I do, exactly what our limitations are. You never realize that when you're studying and you're trying to get there, you're always you have a sort of starry-eyed view things. But when you start seeing the reality and you're saying, well, actually, who am I actually getting better here? Who am I curing? Who goes away and never comes back because they're completely happy? And there was only a handful of such patients. So, based on these questions, I thought out and I thought, well, what do I do? If my medicines aren't very effective, then what is my role as a doctor? And slowly and gradually, I recognized that perhaps medicine should not be just about distributing pills. Perhaps there's more to medicine than that. And perhaps those aspects that we tend to disregard are even more important than the pills we dish out. And those include engagement and empathy. So, building a relationship with the patient, or making them feel like you care and that you're willing to listen to them. And for that little while that you have that interaction, making them feel like they're not alone and that you're willing to share their burden that they carry with themselves. And then, so engagement, empathy. And then I thought education, the role of education is so important. The ability to allow someone to understand what's going on, how it came about, what the limitations are with what you have to offer. And then using that education as a means of empowering the patient to ask questions, empowering the patient to take charge, to take control. Because one of the big problems, I think, when anyone develops an illness, it's this feeling of loss of control. It's outside your hands. You're just waiting. And sometimes, being able to empower a patient to say, okay, well, you can do this and you can do this and this. And also one really important aspect of medicine, which again is disregarded, is that the study and management of disease cannot be disjoined from the study and management of its effects on a patient's identity. That, I think, is really, really important. Allowing people to continue to be who they identify themselves as. Because if you lose that, you lose everything. If your whole life was about running and then you develop a chronic disease and the doctor just comes and says, well, you can't run it, that's devastating. And to be able to help people hang on to preserve their identity during times of chronic disease is really important. So I started realizing that, these are really valuable things that are missing at this point in time, and to try and get that out. So I started using social media as a means of just putting out videos where I would talk about conditions in a reassuring manner, using simple, plain language, and where people are not feeling that I'm trying to sell anything. I'm trying to sell my personality. I'm trying to sell who I am, but not a product as such. And so I started putting these videos out, and after a little while, I started realizing that actually people said nice things and they appreciated them. And I thought, this is making me feel good. And this is making me feel better than my day job was, because in my day job, it was just, I would get 5 minutes, the patient would come, I'd give them these pills, they'd go away, and that's it. But when you put something out there, something that is not constrained by protocol, someone else is not telling you, so you can just express what you feel, and you can sort of express that in a very human manner, then that can be very nice for the person doing it as well. So it was very empowering for me, and I really enjoyed it. And then it took a life of its own, and now the channel, thankfully, is doing well, and I'm really enjoying it. The thing I enjoyed the most in my day-to-day life.
Brilliant, yeah. I can attest to the skills you have, the human approach that you have, and quality of the videos. I really enjoyed them. because I learned from them. And then also, they're just Progression Health podcast is brought to you by BetterHelp. BetterHelp is an online therapy service which will help you to more effectively manage your mental health. Mental health is very important, and it's something that all of us are realizing now, especially after the pandemic. During the pandemic, for me especially, it was very challenging, and I reached out to BetterHelp. I tried out a few of their licensed therapists, settled on one for the majority of the pandemic, and I found the help that I received invaluable. And the great thing also is that you can speak to your therapist outside of sessions. If it's not working out, you can switch. Very affordable. It's really easy to use also. And if someone hasn't tried therapy before, but you're kind of, you're curious, I would highly recommend BetterHelp. So what we've done is we've got a sign up link I'll attach in the show notes, and basically you can get a discount to get started and start improving your mental health today. So BetterHelp for better mental health. The Progression Health podcast has teamed up with TRX. So TRX is a bodyweight training piece of equipment that you can hook up anywhere, anytime, and I highly recommend it. I use it in every session with my clients. I use it to warm up and also for stretching. But if you are traveling, which is where I recommend everyone use it, it's hard to get to a gym, it's hard to find the time, but you could literally work out from your hotel room with the TRX and the door attachment that it has, where it doesn't damage the door, but it gives you an effective workout. I also like to add in other things like glute bands and resistance bands, but once you have the TRX, then you can figure all that out. So get yourself 50% off on the TRX home workout equipment with the code Progression Health TRX and boost your workout effectiveness and consistency. Very informative. I think you come away with something in nearly every video, which is great. So you spoke about empowering clients and patients. So, what are kind of some of the typical, we'll say, techniques or just kind of ways that you have empowered some of your patients?
Yeah, I can give you an example of this. I came across a lady who was about 55 who was completely broken mentally and physically. And the story was that she was a really healthy woman, well-to-do, in a really great job, and everything was great. She had, she enjoyed hiking. She enjoyed going and seeing her daughter in Australia. She loved traveling and everything else. And one day she started noticing that she was getting breathless when she was walking. So she eventually went to a doctor who did a blood test, and they said, "Oh, your blood test is elevated. This suggests that you may have heart failure. So we're going to send you to a specialist." So she sat there thinking about this, and she Googled, and she found all this horrible information about heart failure, which made her increasingly concerned. She waited almost 6 weeks to see a specialist. And those were 6 weeks of sleepless nights thinking, I'm going to say this, I'm going to ask this, I've got this. What does this mean for me? What does this mean for me being able to go and see my daughter? What does this mean for me being able to hike with my friends? What does this mean for me? So when she went to see the doctor, she had 5 minutes. The doctor looked at her and said, "Yeah, you've got heart failure, and I think you need to be on some pills, and we're going to get a nurse to come out to you and give you some pills." And that was it. And she was shell-shocked that was it. 6 weeks of sleepless nights for a 5-minute consult with some tablets dished out at the end. So eventually the nurse came to see her and said, "Look, you've got this, you're on these medications, and these medications are good." So she started on the medications. And then she started noticing that she was getting a bit more tired. She was not sleeping well. And it was very difficult for her to tease out whether it was a condition, whether it's anxiety. But what she suddenly started finding was that she was just not really enjoying life anymore. She started becoming more distant. Her husband, she became scared of any kind of intimacy with him. She stopped going out with her friends because she felt that everyone would try and mollycoddle her, and she was told that walking and hiking and doing those things weren't helpful for her, weren't going to be good for her condition. She was told, "Look, you can't have alcohol because you've got heart failure. You can't have caffeine if you have heart failure." She went to the doctor because she was getting so depressed and increasingly lonely and socially isolated. She went to the doctor. The doctor said, "Well, I can't give you any antidepressants because you've got heart failure. You need to wait." Eventually, she became so miserable that she went and paid a professor in Harley Street, to see her. And she went in, and the professor looked at the thing, looked at her notes, and looked at her medication, and says, "Oh, no, don't worry, you're an optimal management. There's nothing else we can do, but you're an as good as management as you can expect." And that was it. And she was discharged. And so eventually she watched me on the videos, and she came to me and she said, "Look, I just don't know. My life is a mess." And I said, "Yeah, I agree that the pills that you're taking are the right pills, but clearly this is not optimal management. This is, I disagree with the professor who saw you. This is not optimal management. Let's talk. And she explained to me, and she told me who she was, and she told me about her life and how much she loved hiking and how she would love to go and see her daughter. And during the course of that conversation, it became apparent what mattered to her. What mattered to her was not that she took tablets. What mattered to her was that she try and reclaim her identity. She was losing her identity. I was able to spend some time with her and say, look, let's talk about sex in heart failure. And, all the data points to the fact that this is not something you should be scared of. Let's talk about it. I was able to reassure her with regards to that. I was able to reassure her with regards to traveling, and I was able to show her data and say, look, on what basis do we think that something bad's going to happen to you? These are all fears that are enslaving you in your mind, and there's no reason why you can't travel. And there's no reason why you can't hike. In fact, actually, exercise may actually be good for you. So suddenly, because she developed a good relationship and she sort of developed that level of trust, she slowly started doing those things. And it was only about 6 months later, she sent me a picture of her with her daughter and a new granddaughter in Australia. So she'd finally made it to Australia, beaming smile, with her daughter and her new granddaughter and her husband. And, that's where this person wanted to be. This is where she wanted. She didn't want to be a heart failure patient on 4 different tabs. She wanted to be the person she was. All those things that made her who she was, she wanted to be able to reclaim those. So for me, that's a very satisfying thing. When I think about it, I think, well, I would never know. I don't know whether my tablets would make a difference or not. People say they would, and maybe they do in a population. But do they make a difference to her? Who knows? We'll never know, right? No one will know. How do I know that by giving those tablets, I've made her live long? There's no way of knowing. But what I do know is I've improved her quality of life by spending some time with her and educating her and making her feel empowered to take charge.
Well, that's amazing. Yeah. Yeah. Sorry, keep going.
So those are the kind of, those experiences, they enrich me and they enrich the patient. And that I think is so nice about this.
Yeah, that's like a true kind of, success story. Do you think that that's what a lot of patients who would feel like they're in need? It basically sounds like kind of a bit of autonomy, independence. Do you feel like that's what a lot of people are lacking when they feel like they're, kind of quote unquote sick, or they have a diagnosis or there's symptoms that they can't manage their life effectively? Or, what would be kind of a commonality among patients you see that is kind of the common, we'll say, ailment?
I think everyone longs for freedom. I think everyone longs for freedom. And actually, I think bad medicine tends to enslave and good medicine tends to liberate. And that, I think, is the big thing. So, people like to know, to have a diagnosis. It's nicer to know to have a diagnosis than not to have the diagnosis, because at least that way, medical professionals speak that language because they recognize the diagnosis. So there's some research. You don't feel as alone if you have a diagnosis, because there are other people who have the same diagnosis. So you can identify yourself with other people who are going through the same thing. When you don't have a diagnosis, it's much tougher. But more importantly is the fact that most people just want to reclaim their quality of lives. And unfortunately, what tends to happen is wherever someone is sick, there is all this kind of general advice, this kind of cookie cutter advice. Don't do this, don't do this, don't do this. This could be bad. And everyone sort of suddenly takes on the role of being a carer. And what patients want is patients want to go back the way they were. So I think when there are 2 ways to take this whenever you're faced with a disease. One is you allow it to enslave you. One, allow it fill you with fear. I can't do this. I'm a patient. I'm this. On the other hand, you could say, okay, well, this now teaches me that I have only one life and I'm going to enjoy it. I'm going to make the most. I'm perhaps this brutal unveiling of my fragility will become my strength.
Very good. So kind of just looking big picture at, let's just call it Western medicine, say in, Great Britain, America, what would you say are some kind of like shortcomings that people should be aware of when, they're going to a hospital, so that they kind of get the most out of it? Because your approach sounds like, amazing, that you're empowering the client, but then you gave an example of a situation where I keep on saying the client is a personal trainer, but it's a patient. So the patient wasn't empowered. They were given medication. So, what are some things that people should be aware of when they feel like they need to engage with, let's say, Western medicine?
Yeah, I think people should never be scared of asking how good the medication is. So that I think is really interesting because, what happens is we get, you come to a hospital and says, oh, you need to take this and you need to take this and you need to take this. And I think that the first thing that patients should realize, because it's very confusing and chaotic and scary and lonely when you're worried about your health and someone says there's something wrong with you, and so you go there and you think, okay, well, you've given me 5 different tablets. I think the first way to try and approach this is to say all tablets, all meds should either make my quality of life better or make me live longer. Because really, there are only 2 dimensions to life, quantity and quality. So any treatment you have has to either improve your length of life and prevent bad things from happening to you, or improve your quality of life. Now, the thing with quality of life is a subjective thing. So, you know what your quality of life is. You take a tablet, and if your quality of life gets better as a result of the tablet, why wouldn't you want to take that tablet? Length of life, unfortunately, you will never be able to measure. Someone else will measure it because the only time you can measure your length of life is after your life is over. So the problem then is, well, if someone's going to give you medications for improving your length of life, unfortunately, you or that person will never know whether that medication has actually lengthened your life. So you're just taking it, right? You're just taking it, hoping that it'll give you the benefit, but you'll never know. So to my mind, it's very important for patients to understand that. One, you want to know, okay, if it does prolong length of life, how do you know it prolongs length of life? Well, has anyone studied a population of people just like tried this medication on them and found that population lived longer as a consequence of taking that medication? And how much longer? And how many people lived longer in that population? And that will tell you about how effective or how worthy that medication is to be taken, to be invested in, right? So the problem is no one gives you that data. So if something, they'll say something like, oh, well, it reduces mortality by 30%. But the problem with that is, you can have, it's a little bit like saying, okay, well, you buy a lottery ticket and you say, okay, well, what are my chances of winning? And someone says, oh, don't worry about that. Buy 2 and you double your chances of winning. It's percentages, relative percentages. They don't really make any sense. You want to know exactly what the numbers were and how many people survived as a result of taking the medication compared to those who did. You would be surprised that not many doctors know that data. We are just brainwashed and we're told, give this medication because the guidelines say so. And we just give it. Now, unfortunately, you wouldn't go to a car salesman and buy a car from them if they couldn't give you the figures you want about the car. But we go to a doctor and we will take the medications, put that chemical inside us without ever asking that question or being given a good answer. I think that's really important. And I think the other thing to say is, I don't mind if a medication makes me live longer, even if there's a very tiny chance, then I'm okay taking it, provided it doesn't adversely impact on the thing that I can measure, which is my quality of life. So, if someone says, oh, this is good, you'll live longer, but I find this medication gives me pain every day, then I don't see any benefit in taking that because it's destroying the one thing that I know for something that I'll never know. So that's really important. And a lot of patients don't understand that and unfortunately don't feel empowered enough to ask those questions. To say to the doctor that, look, okay, you're giving me the medicines. Tell me, are these to make me feel better? Are these to make me live longer? Okay, the ones that make me feel better, I'll try out. And if I feel better, I'll continue them. If I don't, then I'm not going to continue them because why should I continue them? And the ones that are designed to make me live longer, well, firstly, tell me how much better, how much longer I'm likely to live based on the data that you have used to recommend these medications. And 2, sure, I don't mind trying them if the data are good, but if they make my quality of life worse by giving me horrible side effects, then I can't see any point in taking them. Unfortunately, what happens is doctors will just pile the meds on, keep piling the meds on. And I think these days a good doctor is one who takes away the meds rather than gives more.
Yeah, absolutely. I feel like that's where your work comes in with communicating the research, the data, the science in an easy to understand way, because it can get very technical, very kind of jargony. And, for the patients, it's almost impossible to know who to listen to. Some people are selling stuff, like you said. So it's kind of like, there's a conflict of interest there. So just for people listening and, they're like, oh, I have this health ailment, or maybe it's with their heart even. How should they know when is a good time to see a specialist such as yourself? And then, what's the kind of general age that men and women should get their heart checked?
Yeah, I mean, I think the first thing to say is that, what do you do in terms of most of the data tell us most of what we do in cardiology in particular. I don't think we're very good at preventing things. I don't think we have medicines which are very good at preventing things from breaking. I think our medicines are better at patching things up once things are broken. So what I'm trying to say is I don't think there are many medications that you can take which will reliably say, okay, now you won't have a heart attack. But there are medications which are good if you have had a heart attack at preventing you from having a second. So when you're trying to prevent bad things from happening, the first question you have to ask yourself is, why do bad things happen? And to my mind, again, I've broken it down into 4. I think age has a role to play. Well, you can't do anything about age. So as you get older, things break, things go bad, but you can't do anything about that. And then there's genetics, which has a huge impact. But again, you can't do anything about genetics either. And then there is that component of just bad luck. You may just be very unlucky. And again, you can't do much about that. And then there's finally lifestyle as well. And you can do something about lifestyle. So wherever possible, I think it is important for people to pay attention to their lifestyle. Now, if you don't pay attention to your lifestyle and you're worried about your heart, and you feel that having tests on the heart may allow you then to pay attention to your lifestyle, then good. Okay, have it. But if otherwise you're well and you're happy and you're getting along and you're trying to do all the best things you can by just continuing, unfortunately, there are very few medications out there which would then take that person who is just getting on with their lives, but then they find that they've got some calcium in their heart arteries, at the age of 60 odd. And obviously the connotation is if the calcium, you could have a heart attack. What do you do to reduce the calcium? Well, actually, at this point in time, the only things that work are lifestyle, good lifestyle. And perhaps some people talk about giving those patients statins. But a lot of people, again, the numbers needed to treat are very, very high. The benefit, you would have to treat a ton of people over several number of years to achieve any kind of benefit in that setting. So really, it all boils down to trying to live a good life, a life which is sort of a life of moderation, a life where you're paying attention to nutrition, regular exercise, sleep, and stress. And I think stress is really important. Managing stress is very important. So if you say to me, do I need a checkup? I think if you have symptoms, you definitely need a checkup. So if you are breathless and you're finding you're getting more breathless, or if you're getting chest pains, or if you're getting heart palpitation, something like that, you definitely need a checkup. If you're getting on with your life, could something be brewing? Sure, something could be brewing. If you had a checkup, could that be identified? Sure, it would. But what do you do about it? And that's the real challenge. At this point in time, it's just good lifestyle. And some people talk about giving statins. So at this point in time, as you know, there is a technique called calcium scoring, which is where you can put a patient through a scanner and identify their heart arteries. And the majority of people in their sort of 50s and 60s, the majority of people, if anything bad's going to happen to them, it's going to be a heart attack, a sudden heart attack. That's the thing that kills the majority of people in that age group. So heart attacks happen because of progressive buildup of plaque in the heart arteries. And this test allows you to identify plaque in your heart artery. So you identify the plaque, but then what do you do about it? Well, at this point in time, most people don't put stents in or do bypasses unless that plaque were really tight, causing a real tight narrowing, and the patient were getting symptoms. So in the asymptomatic patient, unfortunately, knowing has just caused a whole load of anxiety, and you end up sitting there thinking, oh my God, I wish I never knew, because if no one can do anything, if there's nothing that you can do about it, why do I even want to know? I was much better off not knowing, right? So these are the dilemmas. I mean, I sometimes think, oh, I want to get a checkup. And then I say, well, what do I do with that information? I go to the gym. I try and maintain a really good diet. I try and, if I can change something on the basis of that, great. Sure, I would. But if this is my life and I can't change, or I think that I'm doing the best I can, then as long as I'm asymptomatic, my own approach would be just to get on and enjoy my life.
Don't add in any additional stress, because life is stressful enough, I guess.
It is, isn't it? Because, again, for example, this is happening all the time. People buy blood pressure machines, then they'll say, oh, my blood pressure was a bit high. Oh, gosh, my blood pressure is high. What does that mean? Next thing they go to their doctor, they're worried about their high blood pressure. Their blood pressure goes up. The doctor does it. Oh, your blood pressure is high. Now you've got two people. Fine. Next thing, you've got you've been put on medications and you carry this label of high blood pressure. Next thing, your insurance goes up. Your travel insurance goes up. That increases your blood pressure further. Next time you go to your doctor, you're taking a tablet, you're getting side effects, you're not sleeping well. He does the blood pressure, it's high again. He puts more tablets on. And actually, was that blood pressure actually doing you any harm? Just happened to be that you measured it one day. So it can end up, people end up being overdiagnosed, over-medicated. When you measure things, I think personally, as long as you're living responsibly, living a life of moderation, just enjoying your life, and as long as you don't have symptoms, it's as good as it gets. That's where we all want to be, right?
To have kind of serenity and peace, and not to lose kind of like vigor or the desire to live life to its fullest. Yeah. So
I think
so. Then, is there no general recommendation for men or women as they get older? For when they should get their heart checked, or is it kind of like it depends on the case and the symptoms and that kind of thing?
I think so. I mean, I think all the evidence these days, certainly for coronary disease, again, which is the big killer, is that you don't really do much, or there's no real major benefit in doing things if the patient is completely asymptomatic.
And I can imagine, kind of like you said as well, that if there was a cutoff, 50 years old, I think the population would automatically start worrying. And they would just start to, imagine scenarios where, oh, my heart, oh, that's my heart. Oh, this is it. Yeah, I'm on the way out now, and it mightn't be the case at all.
Certainly for the cardiac side of things, things like cancers, etc., stuff like that. I think, there is some merit in getting checked as you get older, especially if you have risk factors, etc., because getting checked, there's a treatment that can be offered straight away. But with coronary disease, there's no easy treatments. If you were completely asymptomatic, you're living a normal life, someone says, oh, you've got a 70% narrowing in your heart artery, you need a bypass. You would say, well, no, I don't want to have a bypass. Well, I've got nothing wrong. I'm just getting on with my life. I'm okay. Why are you wanting me to go and have something that major? So it's, when I talk about, just getting on, and if you're asymptomatic, just living a normal life, it's mainly to do with cardiac things, heart things, I think. If you ask me, I mean, in general, there are three things that can go wrong with the heart. If you sort of, just for the sake of trying to answer that question in a bit more detail, there are three main things that can go wrong with the heart. Number one, the heart is a pump, and that pump could be in some way damaged, either because you were born with a damaged heart, or you may have developed a weak heart over a period of time and not known about it. That question can be answered with an echocardiogram, an ultrasound of the heart. So you have the ultrasound, if you have a structurally normal heart on that, then that's as good as it gets. The second problem that can happen with the heart is that the pump itself may be healthy, but the blood supply to it may be restricted. And this is where this cardiac CT scan, the scan that allows you to delineate the heart arteries, comes in. And if that is normal, completely clean, then that's exceptionally good news and tells you that you're not in any major risk in the next 3 to 5 years. And then finally, the heart is also an electrical organ, and it may electrically malfunction. Unfortunately, you can't diagnose that before it happens. It has to electrically malfunction, then you diagnose in retrospect. I could be sitting here and my heart could electrically malfunction tomorrow. There's no way of me knowing about this. But if it does malfunction, then I get things like palpitations or blackouts. Then doing heart monitoring over a prolonged period of time can be helpful. So those are the three basic tests that give you a good evaluation of your heart. But as I say, I wouldn't rush into them, because you may find things that you don't want to know about and you can't do anything about. But if you get symptoms, absolutely, because then you know that tackling the thing you've seen will relieve your symptoms, thereby improve your quality of life.
Good, yeah. It sounds as though the modern approach as well covers most of your boxes there. And then I guess kind of just not worrying excessively if there is no symptoms, just focus on the symptoms. And if they're not there, focus on moderation seems like a very effective approach. And speaking of moderation, so I know with COVID, mental health has been an issue for some people, and anxiety as well. I experience it a little bit, but moderation helps, and that's how I keep it under wraps. But how does anxiety and things like depression, how do they affect the heart, if at all? Is there any kind of side effects?
Absolutely. I mean, I think the first thing to say, anxiety and depression are an epidemic. They're not recognized as such, but virtually every patient I see in my cardiology clinic will be taking antidepressants, anti-anxiolytics, etc. And you have to ask, where is this coming from? Why are so many people so anxious? Why are so many people so depressed in a modern world where everyone's meant to be connected, etc.? Where is this coming from? And I think some of it at least comes from loneliness, even though we purport to be more connected, we're actually less connected than ever, I think. The second thing to say is that, anxiety and depression, they directly impact on the thing that matters in life, and that is quality of life. Quality of life is the only thing that is important in life to us. Length of life matters to other people because they become deprived of you if something bad happens to you. But for you, the patient, the only thing that matters is your quality of life. You want to be independent. You don't want to be a burden. You don't want to be in pain. You want to have your dignity intact. You want to be fully functional. As long as you've got those things, that's really important. And so anxiety and depression, they say anxiety doesn't stop you dying, but it stops you living. And so they take away your quality of life. Anxiety and depression are also known to be very inflammatory to the body. And actually, if you look at most chronic disease, the basis, the foundation of chronic disease lies in inflammation. And anxiety and depression will enhance that inflammation. And you can often get into a vicious cycle where people develop a chronic disease, develop anxiety and depression, and that anxiety and depression makes the chronic disease worse because it affects your sleep, it affects your nutrition, it affects how you are, and you get into this vicious cycle and everything gets worse and worse. And then finally, of course, it's big business to give people antidepressants and anti-anxiolytics, and those medications probably also have effects. They have side effects, they have effects potentially, even though some of them have cardiac, can increase the risk of heart rhythm disturbances, etc. So, some people say that actually prescription medications, we're the most over-medicated generation ever. And I'm sure that has an impact on us. So in every way, stress and anxiety are bad for us.
Yeah, I like the idea of focusing on your quality of life. That's a really important metric, no matter what age you are, who you are. So yeah, focusing on that and things that improve your quality of life is really practical and very useful. So I hope people listening will take that home with them. So I've heard of an idea of people who are metabolically healthy while also being obese. So typically, I think the view has been that if you're overweight, or actually let me update the term and say like you're carrying excess body fat, that you are, unhealthy and, you're kind of, let's just say, less capable than someone of a normal weight. But then the new term that's come out is that you can actually, your metabolism can be healthy. So do you have any thoughts around this? And, is it possible to carry excess body fat but still have a healthy metabolism?
Yeah, I think so. It's not a subject I know too much about, but I definitely know that you can carry. I think one of the really interesting things that I've become aware of is this idea of the metabolic syndrome and diabetes in particular, because excess body fat, the big problem is this thing called metabolic syndrome and development of diabetes, and diabetes as a risk factor in hypertension, etc. Unfortunately, the way diabetes is managed, to my mind, is poor at this point in time, because what people do is that they use the blood sugar. So in some ways, if your blood sugar hits a certain point, a mark, HbA1c levels, then you're termed as being diabetic. And if it doesn't hit that, then you're not diabetic, right? So unfortunately, the measurement of sugar levels is what allows people to make that diagnosis. But unfortunately, when you look at those people who have just had a diagnosis of diabetes made, and you look back, you'll find that many of them have already developed the complications of diabetes that would normally take 5-10 years to develop, even before they were diagnosed as being diabetic. So you've already developed the complications associated with the condition before the condition is diagnosed, which tells you that the thing that you're using to diagnose the condition isn't a very good thing, because ideally you want to diagnose it before the complications develop, not after the complications develop. So unfortunately, what is then beginning to happen is that, okay, well, fine. Then what happens is you try and treat the sugar, right? So everything is about bring the sugar levels down. That's the treatment. Well, then what happens is, why is that? Why do we do that? We do that because we think, okay, otherwise something bad will happen. This patient's more likely to have heart attacks or strokes later on. That's why we want to keep the sugar level down. Well, the research points to the fact that even when you do that, you don't seem to prevent macrovascular complications in the end anyway. So I get it all the time. I'm on my coronary care unit, and I would say, oh, tell me about this patient who's just come in with a heart attack. And they'll say, oh, yeah, he's got high blood pressure and he's had diabetes for 20 years. And I say, okay, and what's he been doing? And they say, yeah, he's been treated for diabetes for 20 years. And then I say, okay, so what are his risk factors? Why is he coming with a heart attack? And he says, oh, well, he's diabetic. That's why. I said, well, why was he being treated for 20 years then? If you can't treat him for 20 years to prevent a heart attack, and then when he has a heart attack, say, oh, well, that's because he's diabetic. What was the treatment for? Why have we subjected him to treatment for 20 years? So the point I'm trying to make is that the thing that, even with diabetes, is that we are going by the wrong marker. We're looking at the sugar, and perhaps we need to be a little bit more sophisticated. And increasingly, people are beginning to realize that this thing called insulin resistance, and perhaps we need to be more sophisticated. Maybe it's not maybe what's happening is our body is being hit by regular sort of dietary sugar, because sugar is in everything we eat, right? It's everywhere. So maybe our body is being hit by regular sugar surges from food, and our bodies are producing more and more and more insulin to try and keep that sugar down. And maybe it's the insulin that's harming us. And so you start developing the problems over a period of time. And it's only when your body can't produce any more insulin to cope that your sugar starts going up and you start being called diabetic. And maybe we should be more sophisticated and look at insulin levels and how our bodies react to insulin levels, or how insulin levels vary in our bodies, as a means of telling us how metabolically healthy we are.
Yeah, very interesting. And even other factors like the lifestyle factors like stress, sleep, all these other things, instead of just the sugar. It's like life is much more complicated, and there's a lot more nuance to a condition than just the sugar levels. And we could actually improve someone's health and their quality of life a lot more by looking at the other factors than just the sugar. I hope I'm not overstepping my position here.
No, you're right. What I'm saying is that the way we're doing things and our understanding is still very basic. And we need to be a little bit more sophisticated. We need to say, okay, because a lot of people will say, well, look, my blood sugar levels are okay, which means I'm healthy.
Yeah.
Well, maybe you're not, maybe you're not. So, because maybe you're still getting all the destructive processes going on in your body, and your sugar levels simply haven't risen to the point where they'd be called diabetes. So what I'm trying to get across is that we have to understand that there are real limitations in how things are being done. And a lot of the reason why things are being done in a certain way is cost effectiveness. It's health economics, etc. So in the NHS, for example, it is far more expensive to be a lot more sophisticated. It's more time consuming, etc. So it just seems sensible just to do this. But that's not necessarily the right way. And those people who are empowered with information, who are able to ask questions, will then go and say, actually, maybe I need to go and find those clinicians who will look earlier for earlier processes going on in my body, rather than the way things are being done, because the way things are being done isn't making a huge difference. We're very good at patching things up, but if you look, heart attacks are on the rise. Younger people are having heart attacks. You're seeing it all the time, So we're good at patching things up, and we would say, oh, well, people are living longer now, but are they living better? Are they, or are they just heavily over medicated, et cetera, et cetera? So when we're trying to work about how to preserve health, I think some of the ways that we define health at this point in time need to be modified, and we need to be more sophisticated and say, okay, well, I need to understand my body. I need to look at it in a bit more detail. I need to look and see if there's a process going on, rather than relying on a surrogate of that process rising. So the blood test is an easy surrogate. But actually, when you really look at it, the surrogate isn't a great surrogate.
Yeah, actually, speaking of being more sophisticated, just your approach with that example that you gave of the woman who was unable to see her daughter, that sounds like a much more sophisticated approach to actually have a sort of just a human conversation with them, as opposed to seeing them purely as a patient who needs medication. Is that your typical approach with a client? Do you have the time to really understand their situation, or is it that it's always so limited that you can only have 5 or 10 minutes with the client?
Yeah, time tends to be really, we're very limited in that time. But as a doctor, those are the things that interest me. Those are the things that connection. We all long for connection, don't we? So for me, I appreciate the fact that my job, my vocation allows me to connect with people, and whilst I may not necessarily have all the time to be able to do this, and I would love to spend more time with my patients, over a period of time, you start developing skills where you can build rapport relatively quickly. And that's another reason why I do the videos, because a lot of patients come and see me and I say, look, why don't you watch this, because this is exactly what I did here, and have a think about it, and then come back and see me, and we can answer any questions you have, etc. So I use the videos as an adjunct to provide information. And for a lot of people, I provide the video links even before I see the patient. So I know they've got this. So whilst they're waiting to see me, say, okay, look, at least you know who I am. So when you meet me, you're not like, oh, you can't, even if you feel like you know me before you meet me, I think I've done something good for you, because that allows us to build a rapport immediately. And then we can get on to the business of me trying to answer your questions and me allowing things to happen which may help work in your favor. So that's another advantage of doing the social media stuff that I do, which is it creates a huge resource of information distributed by me, the doctor that they're going to come and see. So in some ways I'm selling myself, but I'm also expressing my philosophy to them, and hopefully that puts them at ease.
Yeah, you have a strong belief in what you do, but it's well thought out, and you're really effectively breaking the ice with the clients. I keep on saying clients, patients, and they get kind of educated, even before meeting you. So yeah, I think that's a really clever way to approach the health system, because you haven't, I guess, found it as effective as it could be, and you're almost making your own role or approach, which is, that's how I met you. So yeah, it's working. So just going back to connection and kind of pivoting a little bit. So coffee is a great way to connect nowadays. Everyone loves to chat over a cup of coffee, but is coffee healthy for heart health? What's the relationship between coffee and heart health? Because too much coffee, I think everyone has been there and they felt a bit too hyped up. But it's, its benefits. I seem to find every study on caffeine promotes the benefits of heart health, but, longevity. But I don't know, is that true? So what is your opinion on the situation?
Yeah. I mean, there's been a long-held perception within the public and healthcare professionals that caffeine increases the amount of adrenaline in our bodies and will increase the risk of heart rhythm disturbances. Now, the truth is that there are two ways of looking at this. One is to go by sort of research and population studies and see what that shows. And then there's the anecdotal side of things, So there is no doubt, anecdotally, some people will say, when I consume strong coffee, this happens. And in those people, I say, well, if you have noticed a temporal relationship between drinking coffee and your heart palpitating or something like that, then sensible thing is not to drink the coffee and see whether that sorts your problem out, because it's you I'm trying to treat. It's not the 10,000 people who've participated in that study. But if you look at the studies, then they say that, coffee has four main effects on the cardiovascular system. Okay, it causes sympathetic activation, so it increases your adrenaline, noradrenaline levels. And actually, if you increase those to a certain extent, then especially if you've already got a diseased heart, then there is a risk that the heart will speed up. You may get extra irregular heartbeats. You may go into heart rhythm disturbances. So that's true. Remember, coffee contains caffeine, but probably not as much caffeine as energy drinks. So energy drinks are probably really harmful because they probably contain about, 4 or 5 times more caffeine than in coffee. So that's one problem with caffeine, that increases adrenaline and noradrenaline levels. It also can increase the amount of calcium within the cells. Calcium can sometimes increase, can be used to increase the heart rate. So that's another thing. However, caffeine is also an antioxidant. So that's good news. So that's, it has higher levels of antioxidant activity compared to even sort of black tea. And it has an inhibitory effect on something called adenosine receptors. And adenosine can sometimes cause AF. And if you drink something which is an adenosine antagonist, maybe it's protective. So that's the sort of biochemical basis, the biochemical foundation. But when you look at studies, there are no really good convincing studies that coffee causes more heart rhythm disturbances. In fact, there were, in terms of population studies, I think there have been, most of the studies have shown that there's a reduction in things like atrial fibrillation with coffee ingestion. That's what the studies have shown. Same with ventricular dysrhythmias. So, I think the research doesn't convincingly say drinking coffee increases the chances of bad things happening to you. However, the question really is, why are you drinking coffee if you're drinking too much coffee? Is it to cover something else up? Is it because you're stressed? Is it because you don't sleep? I was in America the other day, and I was in America 3 years ago, and I went in the morning Starbucks, and there's a huge line of people, and they've got these big mugs, and you think, well, why do they need so much coffee just to get up and get going? And it's probably because they're not sleeping. It's probably because they're overworked. It's probably because they're stressed. And they're using the caffeine just as a way of, getting them going. And that, I think, if you're using it as an aid, as an adjunct to try and mask all the other compromises you're making, then that probably is a bad thing. So I think in moderation, coffee, there's no really good evidence. There's no evidence that it's a bad thing, but it should be in moderation. It should certainly not be used as something to cover up other inadequacies in one's lifestyle.
Absolutely, yeah. It shouldn't be used as a band-aid. And then moderation is important. And also, you got to be very careful about your sleep. I think sleep is more important than how awake you are during the day. Like, you don't need to be caffeinated at the expense of your sleep. Sleep is just, you can't get by without getting enough sleep, really. So yeah, that's very interesting. And then another very interesting video you had is why magnesium is good for you. And just by the way, I just picked out some of my questions from Dr. Gupta's YouTube channel, so I'd highly recommend that. But the one that I currently am referencing is why magnesium is good for you. So I don't know a whole lot about magnesium, but I've heard a lot about it. So could you just give us a little quick synopsis of it, and then why it is beneficial for heart health?
Yeah, I mean, magnesium is a vital iron that is required in the body. And actually, if you look at all the available data these days, because of modern farming methods, etc., up to 3/4 of the population are low on magnesium. That's the first thing. The second thing is it's involved in several reactions, important reactions that go on in the body. It has several beneficial effects. It has a vasodilatory action. So magnesium tends to open up our blood vessels. When our blood vessels open up, our hearts have to work less hard. So that's important. It has an anti-inflammatory role, and that's important. It has an anti-dysrhythmic role, and that's again important. It has a ton of beneficial effects on the body in general, at least biochemically, it's also very difficult to measure. And therefore, unfortunately, because a lot of people don't know enough about it, they would just do a simple blood test. And if the blood test looks okay, you get told, well, your magnesium levels are okay. The blood test is not reliable at all. And therefore, you cannot go by this. What we do know is that it is something that is generally safe. The body copes with it well. It's difficult to mistakenly overdose on it. And in some people, it can have a really meaningful impact on their quality of life. So, I came across magnesium because I was doing videos on heart palpitation, and there's a particular kind of heart rhythm disturbance known as ectopics or PVCs, which are little skips, which are commonly seen in people who are going through a lot of stress. Very, very scary, very troubling. And a lot of people who get this just are at the end of their tether as to how to get rid of them. And modern day medicine doesn't have any answers to this. So I was doing this, and I then came across a video actually on YouTube by a patient who said, I took magnesium and I felt so much better. And I thought, okay, well, that's interesting. I'd like to look into it. And but I couldn't talk about it because I didn't have any personal experience. And at the end of the day, I'm trying to produce a channel which has to have some kind of data. The foundation should lie in good, honest data. So I looked through all the journals and I found a small study in Brazil where they did use magnesium for ectopics, and they reported that actually, indeed, the magnesium was very effective in reducing these ectopic heartbeats. So I did a video on that. And then what happened is two things. One, a ton of people came to me and said, when they started the magnesium, they started noticing all these amazing benefits. They started noticing their palpitations settled. They started noticing they were sleeping better. They started noticing they were calmer. They started noticing their leg cramps had disappeared. So I thought, wow, great. Now I have some evidence from people saying that it improves my quality of life. They've measured it. They've said it improves their quality of life. And so I started recommending it. And I said, look, anecdotally, I get lots of people saying that they feel better as a result of taking it. And before I knew it, that's been the most popular video I've ever done. I'm amazed because, it's been by far the most popular video I've ever done. And a ton of people, virtually everyone around me, started taking magnesium. And a lot of people come back and actually thank me. I've never had a patient come to me and say, oh, why did you recommend that magnesium? Everyone is happy taking the magnesium, much more so than taking a medication of some sort, because this is a natural thing, and the side effect profile is very good. There's not much in the way of side effects. And suddenly you may just find that there are things that are going on which you've lived with, and they suddenly just disappear.
Brilliant. Yeah, you love to get something that works, because there's a lot of things out there that don't work, especially coming from the fitness industry. There's a lot of supplements that are touted as working and they just don't deliver. So that's brilliant, and great to know that your work is being well received with lots of views. Just one question that comes to mind is the parasympathetic nervous system and the ability to relax and rest and digest and kind of slow down and to activate that system. Do you have any kind of recommendations for people, to kind of maybe sort of settle their heart or lower their stress? You ever come across clients who struggle with that, and you might have to give recommendations around that?
Yeah, absolutely. I mean, there's a lot to be said for, things like this is a big problem. I mean, in fact, there is this whole condition known as a dysautonomia, which is characterized by an imbalance between your flight and fight and your rest and digest systems. Some people even term it adrenal fatigue. It is a burnout where you're hyper aroused all the time. You are wired and tired. And in those people, I think things like mindfulness, deep breathing exercises, having rituals, making sure that you are really spending time looking after yourself, that you're getting into a good routine, that you're paying really good attention to the time you go to sleep, that you're avoiding doing so many things which disrupt the normal patterns in our life. That can make a huge difference, but when you're trying to improve the vagus nerve, it all boils down to when you're trying to improve your parasympathetic, what you have to do is look after yourself. You really have to pay attention to those things. So a simple way to try and explain this is a lot of people will lie on their bed and they'll be looking at their phone, right? And that's a means of relaxation for a lot of people. You know, you lie down in your bed and you're playing on your phone and you're looking and doing this, etc. The problem with that is, again, what tends to happen is we then stop associating the bed with sleeping. So, in some ways that can be quite harmful, because what you're doing is by looking, you're increasing this adrenaline in our bodies, because that's what it does. You know, you're reading news, you're getting blue light, you're flashing lights and all that kind of thing. You're arousing the adrenaline, the flight and fight response all the time. And therefore, that adrenaline doesn't leave you straight away when you want to go to sleep. It stays in your body. And therefore, then you spend the whole night tossing and turning. Next morning, you feel worse. And then when you come back, first thing you want to do is lie down, but because you're still wired, you put on your phone and you do the same thing again. And so for a lot of people, I say, well, okay, you have to be very careful. You do not go and lie on your bed unless you're ready to sleep. You have to retrain your body to understand that actually, if I'm lying on my bed, that means I'm ready to sleep. If you want to go and be on your phone, don't lie on your bed doing that. Those are really important things. So we get into these really, really bad habits. We get into the bad habits of not sleeping, then having more sugar in the morning, then you're stimulating, going without meals for a prolonged period of time, then having a heavy meal after that. I think we just have to really pay attention to try and readdress that balance. And I think breathing, and a lot of people overbreathe and a lot of people hyperventilate. Those things can all have a huge impact. And mental health is so, so important. Physical health, you cannot be physically healthy if you're mentally unhealthy, and therefore mindfulness, stress relief, meditation, Pilates, yoga, Qigong, all those things can be quite helpful. And those people who do it, and exercise is very good. A lot of people say, well, exercise, the reason exercise I think is so good is because it can be a meditative experience. That I think is so important about exercise.
Yeah, it's kind of like you're only as strong as your weakest link. So if you can work very hard, but you can't relax equally as hard, you've got a weakness right there, and you could end up running into problems. And I add another series on sleep, and just going back to the time spent in bed. The experts recommend you're in bed for three things. So for sleep, for sex, and then for recovery from sickness. So the three S's pretty much. Because otherwise, like you said, the body gets accustomed to being in bed but not relaxing, and then you run into sleep problems, which is a disaster. But you just touched on exercise. So to wrap up, could you just talk a little bit about your video of heart disease, so exercise in the heart? Because I think a lot of people would, the go-to might be to exercise less or be less active, like that woman you mentioned. But what is your opinion on exercising, with heart disease and just for general heart health?
Yeah, I think exercise is in some ways the perfect medication, isn't it? Because it gives you it makes you feel immediately better. If you've done, you will know that if you go for a run first thing in the morning, you're buzzing the whole of the morning. That's the first thing. Everywhere we see exercise has been shown to reduce inflammation levels within the body. So it has a direct effect on the inflammatory load in the body, and it doesn't really have any side effects. So in that sense, it's very good. I think one of the most important things for exercise is builds our muscle tone up. So that I think is very important, because with chronic disease, for example, any kind of disease, one of the things that comes along with that is muscle wasting, frailty, which makes everything worse. So keeping your muscles in tone and good shape is incredibly important. I think exercise can be a meditative experience. I think exercise may allow people to be more social. It can be a way of reducing loneliness. It can be a way of experiencing freedom, because when we exercise, we feel free. So it has so many other benefits on our mental health, on our muscle tone. All the research points to the fact that if you take people who have heart disease or who are suspected of having heart disease, and you put them on the treadmill and they do something like called the Bruce protocol, which is sort of every 3 minutes the treadmill goes up in incline and speed. And if they do more than 9 minutes, they fall in a generally low risk category. So people who do more than 9 minutes are low risk. People who do less than 6 minutes are higher risk. So sometimes, you can have people who have a 80% narrowing in their heart arteries. And if they do more than 9 minutes without problem, many doctors may turn around and say, well, that doesn't need fixing. And on the other hand, if they had the same narrowing, but they could only do sort of 5 minutes on the treadmill, then you worry a little bit more and you want to fix it. So just being able to do 9 minutes in itself tells you that you're in a low risk category. The other thing, of course, to say is that exercise can be a very good way of testing the heart out and testing how well you are. If you can exercise, if you have a problem with your heart, it will manifest first during exercise. So the answer is not to exercise. The answer is pay attention to that. And if you do, then you notice something, then it gives you that warning that you need to go and get checked out and get it treated. One other thing I would say about exercise, which is again very important, is that for most people, again, in the 50s, 60s, the thing that's going to kill them is a heart attack. And heart attacks happen because of progressive plaque buildup in the heart arteries. Now, what happens with exercise is that you are in a controlled manner trying to, you're trying to increase blood flow through this narrowing. And of course, the more, if you increase the demand, the supply is not going to necessarily match the demand during that narrowing. In the short run, that's not necessarily a good thing. But if you do it in a controlled manner over a prolonged period of time, your heart will form its own natural bypasses called collateral vessels that bypass this narrowing. It's a little bit like if you have a highway and that's getting progressively narrow, the traffic will find its own will find a way out. The traffic will start taking side roads and getting through because they know to avoid that area, particularly at rush hour, for example. So exercise is like stimulating rush hour in a controlled environment. So over a period of years, you'll start developing these collateral vessels, which allow the blood to get to its destination without being completely reliant on this narrowed artery. So if this narrowed artery does block off, the traffic's still getting through to where it needs to do, so you don't have as big a heart attack. So exercise can be very helpful with that. It's called collateralization or development of collateralization of blood vessels.
Oh, that's amazing. The body is like just, the best machine ever created, right? So that is fascinating to hear. I never realized that before. And good to know that exercise is still medicine. That's something I like to believe in and preach to my own clients. Dr. Gupta, thank you very much for your time. Is there anything that you want to leave the listeners with or mention or, maybe any videos that you have coming up?
Yeah, my message is always the same, that, there are only two important things in life, length and quality. And wherever you are, I think there are three things. The more I think, as part of what I do, you end up becoming quite introspective and you start questioning everything. And I would say that, the things that will always make our quality of life better, the thing that will always make our quality of life better are to care, to share, and to be grateful. And if you do those three things, I think you will find that your quality of life improves. And if your quality of life improves, then that's all we ever want.
Brilliant. Yeah, that's a very practical takeaway. Thank you very much for your time, Dr. Gupta, and we'll stay in touch.
Great. Thank you so much for having me.